I remember a lot of injections and needles and a lot of blood taking. I remember I don't remember what the technical term is, but it was like tubes that would come out of here, and we always call them wigglies. And that's where they would get the blood from. When I went to remission, I was 6.
I think Alexander was 4 years old, and the doctor said, do you want to take a seat? I was like, just tell me. And he said that it was cancer, but at the time, I had never heard of neuroblastoma before. It's not a cancer you've ever heard of. And that's the first time I met Professor Deborah Twaddle. And she kind of explained a little bit more about it, and all the different treatments and stuff that would potentially need to be done.
Alexander had a condition called high-risk neuroblastoma, and neuroblastoma is a cancer of the developing nervous system. And he was treated according to the way that we treat neuroblastoma on a trial which was taking place at the time called the high-risk neuroblastoma trial. Newcastle University has a number of clinical academics, such as myself, who carry out research within the university but also translate it for the benefits of patients within the hospital. And in Alexander's case, what we were able to do was to take some of his tumour, of his neuroblastoma tumour, extract the DNA and look for abnormalities in a gene called anaplastic lymphoma kinase.
When I had cancer, it was all quite new, but Professor Twaddle was all really nice, so all the nurses.
By identifying the faulty gene ALK present in up to 15% of children with high-risk neuroblastoma, it means that we can give those patients an additional form of therapy that wouldn't have been available to them. And the importance of this treatment is that by being directed against the faulty gene, it's what we call targeted treatment or personalised medicine, and so it means that it won't be affecting the other normal cells that the patient has as well.
It was convenient that when I got cancer, I was in Newcastle, and Newcastle happened to be the place that all the cancer research is done.
And I do think being in Newcastle, with the research being here, so Professor Deborah being here, everything's just central. This is the happening place. This is the place you want to be.